Well, it's Thursday, and as you all know, we're joined by In Focus health correspondent Lenore Madu. Hello, and welcome to In Focus again this week.
Thank you.
What do you have for us today?
Today, it's all about malaria. And the United Nations health officials say malaria is the leading cause of illness among children in Togo, and that 44% of children treated in hospitals are treated for malaria. But Togo is taking steps to change that.
Togo's government has launched an anti-malaria campaign meant to reduce the number of children with malaria. Health officials recently distributed some 850,000 nets all across the country.
The nets that are being distributed have been treated with insecticide to protect children. We are focusing on malaria among children from 0 to 5 years of age.
Special attention is being paid to the rural population, where malaria often proves deadly. Better health care and awareness of how to prevent the disease have helped populations in the cities. Health officials and community volunteers trained by the Togolese Red Cross have made house calls to people like Aku Akuyo.
We received mosquito nets to protect our children, and they asked us to take care of them. We welcome this initiative, which will save the lives of our children.
In 2004, Togo vaccinated about 860,000 children against measles and polio and distributed free mosquito nets. Recent studies indicated the need for a new campaign. Health Minister Comlan Mali.
From December 2007 to February 2008, there was an investigation that was conducted which found that the coverage had reduced. Why was it reduced? Because after 2004, children who received the nets grew up to constitute different age group, and since 2004, a new cohort of children had been born.
The Canadian Red Cross and several other aid organizations are supporting the anti-malaria campaign in Togo.
And in Uganda, millions of people now have access to modern malaria drugs for as little as the cost of an egg. The drugs are being supplied through small shops that are often overlooked by Uganda's healthcare system. Herbert Ware has the story.
Artemisinin combination therapy drugs, also known as Coartem, are the first line of treatment of malaria in Uganda. But their cost, about $9, has put them out of the reach of most Ugandans.
At the moment, the people who access ACTs within 24 hours, which is the WHO standard, is only less than 5% in Uganda.
But now, a 2-year project in 4 districts is subsidizing Coartem. The project, between Medicines for Malaria Venture and the Uganda Ministry of Health, supplies Coartem through small village drug shops. 60% of Ugandans use village drug shops to buy malaria drugs. The project taps into this, reducing distances that patients have to travel for effective treatment.
Now that we have it in the private sector, those who are able to buy can easily go and get the drugs day and night. And it is at a subsidized price, meaning that even the disadvantaged group can at least afford to buy it.
But if you look at the child pack of 200 shillings, it's actually going for about maybe 2 eggs. And really we think that this could be, say, you know what, you sell 2 eggs and you have a cure for your child. And that is affordable for the population.
In Palisa, one of the 4 districts taking part in the project, health officials say that treatment of child malaria is on the rise.
The biggest percentage that report to the health unit presents with the malaria, especially the children, the under 5s.
The owners of some 400 village drug shops have been trained to diagnose malaria.
We want to reduce treatment of simple diseases away from overloaded government facilities, and we leave the government facilities to contain mainly the more complicated cases because they have more qualified health workers.
Uganda's health authorities are monitoring the progress of small drug shops in treating simple malaria, and they say that if successful, the program could one day be extended to the rest of the country. I am Herbert Were for VOA News in Palisa District, Uganda.
Really good updates there on the fights against malaria. Thank you so much.
You're welcome.
Lenore. All right, that was Lenore Madu joining us, and please be sure to watch for her every Tuesday and Thursday for the latest health news in Africa right here on In Focus.
And for more information on these stories, go to voanews.com/TV to Africa.